Hi everyone. Sorry it's taken a couple of weeks for me to do another blog. Just trying to figure out how to record and do a PowerPoint through video. So we're up to our third part in a four-part series on nutrition and pregnancy where we're going to talk about gestational diabetes. And if you look at this next slide, I've got a little diagram here that sort of shows you what normally happens in our body without gestational diabetes or without diabetes in general, and what happens in gestational diabetes. So when you're pregnant, the placenta produces hormones that help the baby to grow and develop, and these hormones also block the action of the insulin, which is the hormone that helps to keep glucose or our blood sugar at normal levels. And this is what we call insulin resistance. And because of this resistance, the need for insulin in pregnancy is 2 or 3 times higher than it is normally. So if the body is unable to produce this much insulin, we basically develop gestational diabetes. It's one of the most commonly, it's most commonly diagnosed around the third trimester, usually around the 24th to 28th week, and most of the time goes away when the baby is born. So while maternal blood glucose levels usually return to normal after birth, there is an increased risk for the mother developing type 2 diabetes later in their life. So just to give you an idea of some of the statistics worldwide, it has been basically increasing. Gestational diabetes have been increasing markedly around the world, and they're seeing that it's closely associated with our rise in obesity, our sedentary lifestyle. However, even women with a healthy body mass index can be affected due to some of these hormones in pregnancy that I was just explained before. So around 12 to 14% of all pregnant women develop gestational diabetes, although this incidence is normally higher in some ethnic groups. In Australia, and I'll just go on to the next slide, in Australia, more than 35,000 women develop gestational diabetes every year, and this incident rate is highest among women between 30 and 34 years of age. So those who are at greater risk are those who are over 30, they have a family history of type 2 diabetes, they might be overweight or obese, from Indigenous Australia or Indigenous Australians. They might have an ethnic background such as Vietnamese, Chinese, Middle Eastern, Polynesian or Melanesian. You may have had gestational diabetes in a previous pregnancy. You may have also had a large baby or obstetric complication in this current pregnancy. And you may have also had polycystic ovarian syndrome. So these are some of the women that they're finding are at greater risk. So the good news is GDM or gestational diabetes is treatable, and basically a lot of it involves dietary and lifestyle adjustments to control the glucose levels in the body. But unfortunately there is complications if it's not controlled. And some of those increased risks are for the mother and also the baby, and also later on in life, either for the mother or the baby as well. So for the mother, as I've sort of highlighted here, she has a high risk of abortion, hypertension, preeclampsia, cesarean delivery, labour complications, while in the infant, basically a larger weight at birth, baby, large for gestational age, shoulders dystocia, hypoglycemia, and some other other morbidities and mortalities. So compared to children of mothers without gestational diabetes, babies of women diagnosed with this condition have increased rates of cognitive and motor abnormalities, including attention deficit disorder, learning difficulties, and autism. So basically, the better you control your blood sugar levels, the less likelihood that your baby or yourself can present with complications. So when we test for gestational diabetes, it doesn't always present with easily recognizable symptoms, and that's why pregnant women are tested during their third trimester by taking a special blood test. And to test by testing that, the women then are able to have proper management and treat the hypoglycemia during pregnancy to avoid some of these complications or outcomes I mentioned before. So there are two common screening tools or practices that the World Health Organization advocates for, and there's basically a universal one-step diagnostic approach after 24 weeks of gestation. And first one is the oral glucose tolerance test, OGTT, and that's used to check how your body responds to a glucose load. So after fasting for about 8 to 12 hours, a blood sample's taken. You then have a drink containing 75 grams of glucose, and blood samples are taken again 1 and 2 hours later. And then the diagnosis is made when the glucose value falls at or above the threshold that they're looking for. There is a two-step approach called oral glucose challenge test. And this is a non-fasting test where 50 grams of glucose is administered, and plasma glucose levels are elevated after 1 hour. If the screening threshold is of 7.8 is met or exceeded, a second step, or the oral glucose tolerance test, the first one we mentioned, is then performed. So if you are diagnosed with gestational diabetes, you do need to self-monitor your blood glucose, and basically women should be trying to look at a fasting level of blood glucose under 5.3, and 1 hour after eating under 7.8, or 2 hours after eating about 6.7. So once you have been diagnosed, how do we manage it? Basically what I was mentioning before, a lot of it comes down to diet and lifestyle, and so lifestyle meaning sort of more the physical activity, stress levels, and then looking at your diet. So evidence has proven that around 70 to 85% of women with GDM are able to control their hyperglycemia or high blood sugar levels with lifestyle modifications alone. However, for some women with gestational diabetes, insulin injections will be necessary for the rest of their pregnancy, and approximately 10 to 20% of women will need insulin, though once the baby is born, that insulin is no longer needed. So going through a little bit more about how to eat healthy for gestational diabetes. All diets are individualized. It's not really a one diet fits all, because everyone reacts differently to different foods. Some people might have already a fairly low carbohydrate intake, but might be more sensitive to just small increases. So it is best to be followed through with a dietitian, a diabetes education, and your doctor. So some of the sort of little summary points related to diet, though, are to eat small portions of food often, and maintaining that healthy weight. So avoiding sort of general sort of health tips, avoiding foods and drinks containing substantial amounts of sugar, include some carbohydrates in every meal, and snacking ideally high in fiber. And this is where a lot of the low glycemic index foods or carbohydrate foods are very much recommended, and those that also contain high in fiber. In terms of the amount of carbohydrates, this could range between 90 to 150 grams of carbohydrate per day, but again, that has to be adjusted and planned for with your dietitian, because each pregnant person or woman will be different and will respond differently. Also, limiting the amount of fats you eat, particularly the saturated fats, And yes, sorry, that was my last slide there. But what I also wanted to mention, that there are also some very important vitamins and minerals that have also been found to be very important in helping to maintain blood sugar, and women with gestational diabetes tend to be more deficient in some of these nutrients, and that they are vitamin K2, vitamin D, magnesium, and probiotics as well has been found to have some effect on the blood sugar control, the health of the baby, the weight and obesity risk for a child as well. So yeah, there's obviously a lot of things that you have to think about when you do have gestational diabetes, but when it is controlled well, there are very positive outcomes for you and your baby, and also for the future, so that the complications aren't going to be likely. So in saying that, up to 50% of women with GDM later will develop type 2 diabetes, but those who had a history of GDM, who adopted healthy eating patterns and increased physical activity after birth, have shown significantly reduced risks of developing type 2 diabetes. So again, it's really related to that lifestyle advice. So I hope that's given you a little bit of information about it, and maybe helped you to understand it a little bit better. And if you do have questions, then please feel free to comment or to message me through Facebook or my website, www.growspectrum.com.au, or the Facebook site Growth Spectrum. So thank you again, and we'll talk to you next time. Bye.